لله رب العالمين، والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. General Prevention and Control Measures by Professor Mahmoud Hani Sulaiman. Natural history of disease has three phases: pre-pathogenesis phase, pathogenesis phase, post-pathogenesis phase. The pre-disease stage, pre-pathogenesis phase, in it individual factors promote or resist disease. These included genes, age, environmental exposures, nutrition, social environment, immunity, and behavior. Disease classes. To help prevention and control, we classify disease according to mode of transmission as follows: contact transmission, vehicle transmission, vector transmission, airborne transmission, animal-borne transmission, transplacental transmission. Contact transmission, either direct or indirect; vehicle transmission, water, food, milk; vector transmission, arthropod; airborne transmission, droplet nuclei, and infected dust; animal-borne transmission through zoonosis; transplacental transmission or vertical transmission. For vertical transmission from mother to child, common gestational period for vertical transmission of disease is as follows: in the first trimester, congenital varicella and congenital rubella; in second trimester, parvovirus; in third trimester, syphilis, toxoplasmosis, hepatitis B, and cytomegalovirus. During delivery, HIV, hepatitis C, and herpes. Control measures. We block channels of transmission achieved by general environmental control or environmental sanitation by safe water, sanitary disposal of sewage, sanitary waste, food hygiene, vector control, personal hygiene, proper ventilation, prevention of overcrowding, and dust control. The protection of susceptible population is done by immunization, chemoprophylaxis, good nutrition, health education, and personal protection. So, protection of susceptible population mainly by immunization and chemoprophylaxis. These are two important things. Control measures after occurrence of an infectious disease are early detection of case, isolation of case for period of infectivity, prompt and effective treatment of case, disinfection of discharges and fomites, notification, surveillance of contacts, mass immunization of vulnerable groups, investigation of current outbreak, survey to assess endemicity. What is chemoprophylaxis? Equal prevention of infection or its progression to clinically manifest disease by administration of chemical substances including antibiotics. So, chemoprophylaxis is prevention of infection or prevention of its progression to a clinically manifest disease by administration of chemical substances including antibiotics. Use of antibiotics before surgical procedure is an example of non-specific chemoprophylaxis to prevent wound infections in post-operative period. Examples of specific chemoprophylaxis as follows: chloroquine to prevent malaria, silver nitrate or erythromycin or tetracycline eye drops instilled into eyes of a newborn to prevent gonococcal ophthalmia. tetracycline, sulfonamides, or streptomycin in close contacts of cases of plague pneumonia to prevent plague. Rifampicin in context of meningococcal meningitis. There is other type of chemoprophylaxis to prevent transmission of an infection to active manifest disease, as giving trimoxazole or pentamidine to prevent subclinical latent infection with pneumocystis carinii, to prevent its progression to manifested pneumocystis pneumonia in immunosuppressed persons as HIV individuals. Also giving pyrimethamine with sulfadiazine with folinic acid to prevent asymptomatic infants congenitally infected with Toxoplasma gondii from being clinically manifest chorioretinitis and other sequelae of congenital toxoplasmosis. Another type of chemoprophylaxis is to treat an infectious persistent disease to prevent its complication. The very famous example is giving penicillin to treat streptococcal sore throat due to Streptococcus pyogenes to prevent acute rheumatic fever. The other famous example is giving benzathine penicillin for treatment of syphilis in its primary, secondary, or early latency period to prevent late manifestation of disease as cardiovascular syphilis. Here there are two famous examples, penicillin and benzathine penicillin. Penicillin for streptococcal infection to prevent acute rheumatic fever, benzathine penicillin for syphilis to prevent late manifestations of syphilis. Disinfection. General recommendations. We disinfect anything related to the patient. To summarize, disinfection of the following must be done for all patients. Patients excreta discharges, linen and utensils and other articles used by patient. Area occupied by patient before removal to hospital and their contents. Vehicle in which patient was conveyed to hospital. On recovery of patient, the ward or room in which patient was treated must be disinfected. In case of carriers or contacts disinfection, this should be done at place of care where the physician in medical charge is present. Definitions. Disinfection means destruction of specific microorganisms which can lead to communicable disease. Disinfectants are agents used for disinfection. Antiseptics are chemical agents which decrease growth and microorganisms but are not strong enough to destroy them completely. Disinfestation means destruction of undesirable animal forms, especially arthropod ectoparasites present upon persons or on domestic animals. In practice, refers to destruction of ectoparasites like lice, sarcoptes, bugs, fleas, and their ova and eggs. Disinfection procedures: concurrent disinfection, terminal disinfection, prophylactic disinfection. Concurrent disinfection equal disinfection of patient of his excreta and discharges of all articles used by him or likely to be contaminated during course of his illness, including hands and clothing of attendants. Terminal disinfection, disinfection of room or premises and their contents after patient recovered, died or removed elsewhere. It includes vehicle or ambulance, wheelchairs, stretchers used by patient. This is either local or complete. Local disinfection, disinfection of bedding, bedsheet occupied by patient, walls, floor, furniture including kit box, shelf lockers and their contents, and all other surfaces or articles within 2 meters around bed. Complete disinfection of the whole room and all its contents. Complete, it is the disinfection of the whole room and all its contents. Prophylactic disinfection, it is chemical treatment or boiling of water or pasteurization of milk or washing of hands and so on. Investigation of an epidemic disease. Imagine what happened in COVID-19 case. Importance. Whenever an outbreak or disease occurs in a community affecting large number of people, it becomes a public health emergency and calls for thorough investigation and implementation of control measures. It is important because affect large number of people. It is an emergency case. It needs control measures. Objectives of epidemiological investigation are: know distribution, know magnitude of the problem, identify causative agent, source, mode of transmission, implement control measures, put recommendations to prevent future recurrence. Investigation of an epidemic disease. Confirmation of presence of an epidemic, confirmation of diagnosis, collection of other relevant ecological information, studying distribution of epidemic, formulation of etiological hypothesis, testing hypothesis, i.e. how did it happen, implementation of control measures, submission a report. We will explain these steps. First, confirmation of epidemic. Necessary to verify and confirm existence of epidemic by observing large number of people affected, comparing disease frequencies during same period of previous years. Second, confirmation of diagnosis done from history, symptoms and signs of a sample of cases and lab investigations. Third, collection of other relevant ecological information as sex, affected season, atmospheric temperature, humidity, and so on. Fourth, studying of distribution of epidemic with reference to time and place and person. Time distribution of epidemic by plotting number of cases against dates on a graph curve obtained called epidemic curve to know type of epidemic. This will be explained here. This figure shows different types of epidemic curve. The first one on your left is sudden rise and sudden fall of the epidemic curve. This indicates common source single exposure epidemic. For example, food poisoning. The one in the middle on the x-axis, it is the date. On the y-axis, it is the number of cases. This curve shows sudden rise and sudden gradual fall of the curve. This indicates common source repeated exposures. For example, cholera. Third curve shows gradual rise and gradual fall of the epidemic curve. This indicates propagated epidemic, for example, viral hepatitis A. This is geographical distribution of cases of an epidemic. You place distribution of epidemic studied by plotting number of cases as dots or stars with respect to localities in geographical area map. This is called geographical spot shaded map. The pictorial presentation shows at a glance area of high and low density. Here on the left of the graph is high density. Here is low density. Area of high density gives a clue about source of infection and even mode of spread. This is how John Snow, this is a British physician, was able to focus attention on particular water. Formulation of etiological hypothesis to identify diagnosis, causative agent, possible source of infection, mode of spread, environmental factors which lead to increased occurrence of epidemic. For example, outbreak of acute gastroenteritis will due to Vibrio organisms transmitted from river, well through water. Testing of hypothesis done by making a case control study, as will be explained in the coming slide. This slide shows the exposure, either present or absent, and cases and controls. Exposure rate among cases, it is 40 divided by 50. The total of this is 50. Multiplied by 100, it gives 80%. Exposure rate among controls, 60 divided by 150, the total of this is 150. Multiplied by 100, the exposure rate here in the controls is 40%. So there is an association between acute gastroenteritis and water. Implementation of control measures done at beginning of epidemic on basis of known facts. After detailed investigations, measures modified for better control of the epidemic. Then submission of report, and this report should include recommendations for prevention of recurrence of epidemic. The area is declared free of epidemic when twice incubation period lapsed from the date of detection or death of the last case. So we can declare the area, say Cairo, say Alex, say Aswan, is clear of the epidemic when the last case of detected or died time lapsed twice incubation period. Twice incubation period lapsed since the date of detected or died last case. This is how we can declare the area is free of an epidemic. وفي النهاية لا أجد شيء أقوله إلا thank you والحمد لله رب العالمين.